Welcome. I'm Dr. Thomas Purtzer, and this talk will be on the use of opiates for chronic pain management. This will serve as an introductory discussion, as this is a very complex and controversial topic. After you've come to our office and had an initial evaluation, which consists of a very thorough history, physical examination, and review of your medical records, you and I might decide that a trial of opiates to help control your chronic pain is in order. And that's exactly what it is a trial of opiates. It's no guarantee that opiates will be in your best interest to help you to control your chronic pain. Most patients with chronic incurable pain, which is known as intractable pain, that is disrupting your lifestyle to the point that you're suffering more than you're enjoying life, a trial of opiates is probably indicated. Prior to embarking upon this trial, it's required of all patients that they read and sign 2 documents that discuss the benefits and the risk associated with the use of opiates. The first document is entitled a patient contract, and in that, which is a 3-page document, we outline the risk associated with the use of opiates and also our prescribing policies. A very important concept that comes out of this contract is that you need to have just one physician prescribing your controlled substances. So if we decide to maintain a doctor-patient relationship over the long haul, I need to be in control of your use of controlled substances. Not just opiates, but also any other substances that are controlled, such as tranquilizers, sleeping aids. Now, anticonvulsants are not controlled substances, but and neither are antidepressants. But these are all drugs that I believe should be prescribed by just one physician. The other document that's required for the patient to read, understand, and sign is a document entitled Guidelines for the Use of Controlled Substances. These 2 documents outline a lot of information. The first document, as I mentioned, is 3 pages in length, and the second document is 7 pages in length. After these documents have been read and signed, then we will decide upon which type of opiate is the best to try to control your chronic pain. These 2 documents are designed basically to provide you with what is called informed consent. Informed consent means that you're told all of the potential risk and benefits of the use of opiates to control your chronic pain. The use of opiates to control chronic non-cancer related pain is fairly new and has remained controversial. The actual widespread use of opiates for controlling chronic pain has only been done for the past 15 years. Initially, very few physicians would prescribe opiates for chronic, benign, or non-cancer related pain. Now there are a lot more physicians that are willing to prescribe opiates, but despite this, it has remained controversial. There are a number of physicians that still believe that the use of opiates for controlling chronic non-cancer pain is not beneficial. For this reason, when utilizing opiates to control chronic non-cancer pain, it is very necessary for us to maintain constant vigilance and frequent rechecks. For the trial of opiates to be considered successful, the patient must have a significant reduction in their pain. What I consider to be a significant reduction in their pain is where they lower their pain from an intolerable level to a tolerable level most of the time with minimal or no side effects. In addition to reduction of the patient's pain to a tolerable level, the patient must also have a significant improvement in your daily function. And lastly, you must also have a definite improvement in the quality of your life. So in order for a trial to be considered to be successful, these three things must be present. The patient must have experienced a reduction of their pain to a tolerable level most of the time with minimal or no side effects, improved function, and improved quality of life. If these three characteristics, requirements are met, then it may be decided between the patient and the doctor that continued use of the opiates is in the patient's best interest, and we will continue to prescribe opiates. This will serve as an introduction to the use of opiates in the management of chronic non-cancer pain, or what's called chronic benign pain, by chronic oral analgesic therapy. Further talks will discuss the use of opiates in more detail. Thank you for listening.